Very good morning indeed. Thanks for joining us on this Monday morning. December happens to be the 18th of December 2023. We're just counting days away to the end of this year 2023. And today we want to dive dig deeper into family planning. What is family planning and why is it so essential? Now, the World Health Organization report as of 2023 on family planning has indicated that in 2022 global contraceptive prevalence of any method was estimated at 65% and of modern methods at 58.7%. Wow. For married, all in the union women. Now, of course, there are so many strides that have been taken in this. And between 2000 and 2020, the number of women using modern contraception or contraceptive method increased from 663 million to about 851 million women who are using this family planning. That means an addition of 70 million women are projected to be added by 2030. Wow. Now, the prevalence of teenage pregnancy is also off the hooks, causing a lot of worry among parents and amongst the future of this nation, Uganda being the second biggest population in the world after Niger. Now, we're talking about 70% of Ugandans are below the age of 25, and teenage pregnancies are ranging between 12 and 25 years. Also, the prevalence of HIV is in the same range, now posing a great threat to our future and our economy and our productive economy thereof. We are joined by Dr. Emmanuel Bokalo, reproduction health specialist, and we're going to talk about more of family planning. Maybe for purposes of introduction, Doctor, good morning and welcome.
Good morning, Mr. Chintu Senior.
It has been long.
It's quite long, but I'm glad I'm back here.
Doctor.
Yes, please.
Family planning. What is family planning? Is this the same as contraception or just different jargons?
Well, family planning has two words, family and then planning.
Okay.
For you who know very good English, you know that we are planning for the family.
Yes.
In terms of size, in terms of what I can afford to manage, in terms of balancing what your economies can supply to your family,
okay,
and which kind of quality of life that you can give to your family, and then that determines the number of children that you will give birth to.
Oh.
So that is family planning.
Okay.
So contraceptives are the methods that would help you to plan better because, for example, we have a natural system of the menstrual cycle for women. Men are always ready to produce seed, that is sperm.
They're always ready.
They are always ready.
Okay.
Today, yesterday, in the night and in the day, a man is always ready. It's the determinant of who gets pregnant is actually on the side of the woman, because she's always not ovulating. She has a very small window of about 4 or 5 days window for ovulation across the 28 days of the menstrual cycle. So these contraceptives are only helping us to stop the spermatozoa meeting the ovum that is released, and that helps us to plan better on when we think that we can have a pregnancy in a home. Or within couples. So couples may not necessarily be living under the same roof. So that is what family planning means, and then that's what contraception means.
I like that the contraception help us to plan better.
Yeah.
So with the contraceptives, that means the risks of unwanted pregnancies are minimal.
Yeah, sure.
Oh.
So, no, you know, in the human rights-based approach, they hardly use the word unwanted. They want to use unplanned pregnancies,
okay,
because all pregnancies are wanted, but may necessarily not be planned.
Okay.
So the word contraceptive, it comes from the Latin word contra, that contra meaning against conception. So those are the two words that we are looking at. And whichever method that we use that is effective for the person that is going to use it, then we can see through as we proceed in the next few minutes of our program.
Okay. Are there types of this?
Yes, there are different types. We can grade them into the hormonal types and then the non-hormonal types.
Okay, the hormonal?
We can also look at the long-term contraceptives and the short-term contraceptives.
Okay, let's pick it from the hormonal.
So we can also look at it as a barrier method and then the non-barrier method. So all those can be ranging differently.
Wow.
To the viewer out there. Kiba kyetaagisa omuntu okutegeera kiki twogerako nti waliwo bino ebirimu hormones ndooza hormones kati kigenda kifuuka kya Luganda n'ebitaliimu hormones so tukigeraageranya ku mubiri gw'omuntu ebiri hormonal n'ebitali hormonal okusinziira ku mubiri gw'omuntu okusinziira ku birwadde by'alina eby'omutima oba eby'amawuggwe bitusobola okulowooza nti biyinza ocompromisinga contraceptives ezaffe eza hormonal oba n'eddagala omuntu lyonna lyaliko okumira. For example, the people with that are on ARVs okumuwa hormonal method oba omucompromisinzeemu
hormonal methods anto tutandikira hormonal zeziriwo
tugenda zoogerako hormonal methods ze zirimu hormones. For example, obuweke buno abantu bwe bamira tulina types ezo ziringa 2-3 ekisooka kye bayita combined oral contraceptive erimu ebirungo bibiri ne POP progesterone only contraceptive eyo erina progesterone yokka era ebirungo ebyo biziyiza just first omuntu okubanga afuna thickness ya mucus mu nabaana ye omukyalo ono nga mucus eyo waliwo oluzizo olubeeramu mu nabaana ne lukwata nnyo lulinga nga almost porridge nti sperm tesobola kuyitamu kutuuka ku G weribeera. So ekyo nakyo kituyambako. So waliwo n'obulala bwe bayita implants bwe bateeka mu mikono gy'abakyala obwo buba long term. Ekizibu kya oral contraceptive nti omukyala mwangu wakeerabira ate nga twagala MIC waliwo level y'eddagala erina okubeerako mu musaayi for it to be effective. Bw'okeerabiramu olunaku kitegeeza nti egenda droppinga ku olwo olunaku. So anytime you may have to meet your husband sexually kisobola okuba nti mu budde obwo osobola kufuna olubuto. So omukyala alina okukamiraako buli lunaku mu ssaawa ze zimu z'aba ategese nti ku makya ssaawa emu nga nteekayo akaweke kange kalinamuko abamu ke baleetera nausea baagala nnyo okusesema aba baagala okusesema naye ng'ekyo kyangu nnyo okutangira with the time omubiri bwe kukategeera ng'omukyala yeeyongerayo bulungi
akokuteeka munda
kateeka nako okuteeka munda keeka akali long term usually omukyala abeera nako emyaka nga3 okay naye weeyagalirawo okagiramu but we think that it's important n'okamalayo bwe bakateerayo 3 years time omuntu asobola okubeera nako emyaka egyo nga bw'alowooza oba nsobola okufuna olubuto after 3 years. Usually tuba twagala nnyo bukozesa kuba n'abakyala nti maze okuzaala kati naakamaliza okuzaala saagala kuddamu kuzaala ndabirira ono for the next 3 years. Oba n'abaana bakaagala bali mu universities basobola okuba nga babukozesa. Couples are very, very important for us to tell them.
Ate abaana b'omu university baba bwagazaaki
babawagaza they are sexually active bwabyogedde wano otuwadde statistics eza teenage pregnancy
era obulwadde bwekikaba businga mu baana ba university okusinziira ku bibalo
perfect kitegeeza nti abasinga babujja mu kwegatta
yes
so those kind of things tuba tutunuulira nti one kale tusobola okujjanjaba STIs then pregnancy cost ya ku managing a pregnancy eri high ekyokubiri nti somehow it destabilizes your planning for your life especially when you're in school so mubeeramu ebirala nti can we avoid this, can we also avoid this or prevent this and then what is mukiyita kitya the biggest evil or the smallest evil so netugezaako kulaba nga tu planning and the cost of an abortion is quite high as well.
It's quite high, yeah.
Both costing life and also the morbidities that somebody may not necessarily even get a conception in the consecutive years that they plan. Yes, in case that it was mishandled. And managing it alone as a post-abortal care is also quite a huge cost, roughly about $100 a cost for a person.
Now that makes family planning method a better option. Wow. Yes. So we were talking about the hormonal.
The hormonals.
Now the non-hormonal.
So the hormonals, we also have IUDs that are hormonal.
Hey.
Okay. Yeah, so, but those ones will be, the judgment will be entirely on the person that is seeing you and the medical conditions that you could be having as a person coming for those. Smokers, those people that have heart problems, the people that have a bit of issues with their lungs, we minimize on the use of the hormonal methods.
Okay, if you minimize on the use, doesn't it affect the operation of the hormonal?
We use the options. The other options of the non-hormonal. But if it's not worrying, for example, somebody can use an implant and then they become so obese.
Yeah.
Some really increase in
So doctor, while we're still there,
yes,
do you orient your patients before on the disadvantages of these?
It should be the normal.
Contraceptives?
It should be the normal. But at times people come in overcount and they're like, so I need an injectable. The injectable is also hormonal.
When they've already decided,
they have
what
already
they're going
made
to
a
do,
decision.
without
So
even
they don't want your mbozi. They tebagala mbozi ye yonti atebino begin. No, some of them have already. They only come back to you when they have gotten side effects.
naye kakati ekyo Dr. Tolaba nti that is a very big problem.
That's
because there is a person who asked a question which I want to ask in the same line, that is there any screening you do or test to verify what method is suitable for a woman's blood type or anything, or you just give, and if it affects, it has side effects which are really, really bad, again, they'll come back and you minimize them and maybe tackle them.
When we are in the medical schools, for the nurses when they're in their nursing schools, for the other professionals when they're in their professional schools, they are told what to do. We are given it's like when patients come in, we have to take a whole lot of a minimum of 30 minutes with a patient. But at times we are so overburdened that you take less than even 3 minutes, and somebody has come in, and within those 3 minutes is the sitting time, talking, and then exit time, meaning you've not done the quality work. Before even you insert a family planning method, whichever method you're using, a thorough exam from head to toe, and from systemic examination of all of your patient has to be done.
Wow.
We want to find out what your blood pressure is, what your cardiovascular conditions could be, and are you on any medications that are chronic? Some people hardly ask such questions, you know. All they do is that I think this is best for you, and then this is just by physical and interactions that may not necessarily create a very a clear picture on whether that method would be important for your client, or it would even have an effect on them. All right. Once you see somebody's size is a little bit, somebody's having, people have used family planning method and they have become extremely obese. Others have used family planning and they have become a bit small, very small, because they have lost appetite. Others have had a lot of blood flow after that, menorrhagia that has come because of the method they have used. But all those small side effects at one point can be managed by the person that is seeing the client. All we have to do is that we have to look at the benefits that are overweighing the side effects, and then we can use the method that
how important is this? Should I call it an orientation or a consultation before a parent or before a patient engages into any method of family planning?
The logic here is for you to make an informed judgment and decision that we are making this decision together. It's not about the health worker that, Mr. Chintu, your wife should take this. No, we need to sit down and show you this. There is a barrier method here, like an IUD, like a diaphragm, that we have cups, that cervical cups that we put on the cervix. It's entirely barrier that the spermatozoa doesn't go through the cervical canal, through the cervix, and then all that. Okay, so, and then we plan together, you and me, what would be most convenient. And then you tell me, no, because of what you've discussed with me, I think I would take the IUD. And then we tell you, IUD, you don't need to be having more than one partner sexually. So to avoid any kind of STIs that would try to destabilize your endometrium or whatever, your reproductive system, okay? So this is to be done to people, the health worker that is an expert and the client that is the recipient of the method. and then it hits the balance.
Eyakatwegatako tulina Dr. Emmanuel Bukalu mukugu munkola is simanyi nsobola kiyita mu Uganda but reproductive health specialist munkola ez'okuzaala. Osobola okuweereza ekibuuzo kyo ku Facebook kwetuli oba maaso awo tujja kugulawo essimu dakiika nga 10 obuuze ekibuuzo kyonna omukyala yenna eyo ali eyo. Dokita, abantu tukoze tutya okuba balaga obulungi obuli mu kintu nga tebannatandika kikozesa? Ndowooza kati kubanga e Bulaaya tokkirizibwa kugula ddagala mu pharmacy okuggyako ng'olina ekiwandiiko ekiva eri dokita nga kiteereddwako omukono gwe. Ffe leero obuuliramu katono n'ogenda ku pharmacy ogamba mpa eddagala eryo era n'owa pharmacy n'alikuwa n'ogenda n'okola ebibyo naye nga tomanyi. Tukoze tutya kubanga ensonga eno nkulu nnyo. Abakyala bangi bafunye side effects ebivaamu nga bakozesezza naye n'atuuleeko eyo ne bamugamba bugambi bwaddayo mu ddwaliro ne yeebuuza ku bakugu wali teweetaaga kino.
Because we don't have a conversation with our clients, and two, mu Uganda almost buli omu musawo kati anaawulidde program eno asobola okugenda n'agamba bayogedde ku IUD gy'obompa, you get it, tamanyi oba mu endometrium ye esobola okubeera ng'ewanirira ekyo, tamanyi oba ye ng'omuntu obulamu bwe busobola okuba nga buwanirira method eyo. All in all, kino kyokoze n'olwaleero okumpita wano, it is one of the ways that we can educate our people. One of the biggest challenges is public literacy. Okay, the public health literacy in Uganda is a bit low, and two, people think that all they have on the Google, once they go and ask Mr. Google, they think Mr. Google is the health worker. Otherwise, we would be not having relevance. People would continue on their Google and then they go to pharmacies and then we close out medical facilities. But if we still exist and we are still producing health workers, it means there is an importance more than a phone. A phone should just give you highlights, and then once you go to the health worker, they give you deeper details on one, because some of the things you will not understand. And then somebody has read to understand them for you.
Abantu balekera ogenda ku Mr. Google okumubuuza ebibuuzo
ne bakolako decisions,
ne bakola conclusion. Genda eri omusawo omubuuze kino kiki, kubanga naye kireeta kino abantu tebaagala kutawaana. Ekyokubiri abantu balowooza nti ate ssente olutuuka eri
bagakuta. So even poverty is one of the problems. Nti omuntu ayagala kusasula, for example, you would come to me, I would tell you before maybe you walk in, you will give me 30,000. Omuntu nakibalira mu 30,000 ngendeko wane wa pharmacy ya mwami kintu nja kuspendinga we 5,000. And then until when they get the side effects that you've talked about, then that's when they come to the expert. At times, maybe it has overgrown, and it's out of control. You may not necessarily do much about it.
Doctor, omuntu singa yakozesa emu ku nkola zino ez'ekizaala ggumba neemuviiramu obuzibu alina kukomawo eri abakugu.
Perfect. That is the method, because you don't have solution in home. You only have solution in the hospital. That is it. But anyway, when we go back to the non-hormonal methods that we've been talking about.
Ndowooza Dr. tusigale awo bwe tuba tutambulira bwe tunaddawo tujja genda nga tumenya enkola zino tekigasa kupapa nga ate abantu tebategedde.
So the non-hormonal methods that we have in Uganda for now, we have the cervical cap. The cup, one that tuteka kageri yakakopo kalinga kakofiira
kumumwa gwa n'abaana,
yes, such that omwami ne wobo weegase n'omukyalawo enkwaso zote teziyingira mu n'abaana zisigala awo mu bitundu by'ekyama eby'omukyala. Tulina ne IUD etali hormonal gye tuteekako gye tuyita copper T, okay, tugiyingiza mu cervix. Oza twajogerako sometime ago, omwami we yagituwanga ebifaananyi simanyi lwaki leero tabituwadde, naye ne tugiteeka mu n'abaana neegezaako okubanga elayinga horizontally like that, nga obuntu buno obulinga nga kati bwe kati buyingira wano ku tubal ostium, then omukyala nga ebeera nga nayo barrier nga tekkiriza nnyo nkwaso za mwami kuyingira ku meeting ajiri ya mchala. So all these are existing in Uganda. Waliwo abalala kyewambuzaako last time when we were here, emergency contraceptives. Emergency contraceptives nga bw'owulidde ekigambo emergency. Luli nagamba nti emmotoka erina braking systems bbiri. Erina eno eya wansi eri nnomo, then waliwo ne handbrake gy'okozesa mu emergency. Kati kizibu nnyo okusigala ng'ovugira emmotoka ku emergency kitegeeza erina fault. Era ndooza after some time ekulaga wali ku dashboard nti eno gundi ekooye. So the normal is using the routine methods. This other one is only when it is an emergency. You made intercourse when you are unaware, maybe when you thought that you would not, but it happened. Ate ekyo nakyo kirina issues zaakyo. Abantu bangi bakozeseza emergency contraceptives ne bagamba musawo, but I got pregnant after. When you're ovulating, even if you use emergency contraceptives, it will not help you.
What?
It will only help about 10 to 20%. Then 80 to 90%. Oh yes, Okay.
Yes.
Okay. Then I want to assure the people that when you're ovulating, emergency contraceptives will be of less effect to you. You will conceive, and 80 to 90% of people will conceive when they have had sex during ovulation time. So the best thing is to use the routine methods that are maybe short term and long term.
Emergency pills zino zikozesebwa nnyo abaana mu university oba abatiini abo.
Yes.
Kubanga ennaku zino emibiri giri active. Dr. twali twogera ku embuto zeeyongedde nnyo mu batiini. Mbaana myaka 12, 13, 14, 15. Era y'ensonga lwaki abamu baali bagamba abasonga bagamba oba tutandika okutwala ebintu bino tubisomesa abatiini. Kugamba emergency pill tezirina kukozesebwa. Zajjanga nti ndi mu buzibu ng'ekizibu kinguddeko. So si kubaka waliwo omuntu ng'akozesa emergency pill buli lunaku.
Every intercourse.
Zikosa ki ezo?
Those are high level. Ziba nga kumira obukerenda 16 oba 8 at once.
Emergency pills?
Yes. Okay. Buli obwa routine. Bwe ngambye omira kamu for cycle. Baba nga baka compressions kamu. Obukerenda 8 mukakerenda kamu. Wow. So that's a heavy dose, you know, and you're subjecting your body to this almost every week. It is going to destabilize your menstrual flow. It will disorganize your ovulation cycle. Others could even take 2 months without ovulating.
Wow.
So without menstruating, and others can even have a flow that is continuous. So different people react differently. So people should just be cautious on when they're using this. The condoms, they're both family planning, but also they handle the STIs both for female and male. And they're barrier methods.
Okay.
Yeah. So because what the barrier is that the sperm doesn't reach the ovum, and it stays in the condom that you've used. Either it is female or it is male. So people should understand this. And the condoms would be good for males because it saves you from unplanned pregnancies, but also saves you from STIs, including HIV. So that is the method that can help people on all sides. So that's what we can look at.
Lwaki abantu tebagala kukozesa nkola zino? Barrier. Wandi recommend a barrier?
I would use that for my spouse. I would use an IUD for my spouse. I would use that and I would not have a problem with it. People hardly use female condoms. Actually, they have tried to be marketed almost everywhere in the country, but the reception to them has not been so good. And people are now entirely using condoms, male condoms. And I think the consumption has been pretty good. Though we are not sure whether they're using it as a family planning method or as prevention of STIs, including HIV.
Wandirowooza nti enkola zino twandizisomeseza mu masomero abaana okubayikwipinga?
Squarely so, 100%.
Tezibaleetere ate okumanya ennyo eby'obukaba n'okwegadanga ne bayonooneka boonone singa abamu we balowooza?
Ne bye bamanyi si ffe ababibagambye.
Wanje?
Yesebo. Bye bamanyi si Ministry ya Health ye bibagambye. Waliwo ababuulidde. So we should not close our minds and think that tewali agenda bagamba. Mwami kintu I don't think nti olunaku nsonyiwa okukozesanga ekyokulabirako lwe oba nkyogere lwe wasooka okubeerako n'omukyala waliwo omusawo yali akigambye wakiwulirako ku Ministry of Health oba kyali ku kipande no, but somehow you got to know it, and even if we hide behind curtains, this information is almost everywhere. We've had schools that are teaching issues of sex and homosexuality in schools. Is that Ministry of Health? Was it a plan for Ministry of Education? But somebody somewhere invaded it. And two, the TVs are everywhere that are showing uncontrolled information.
Cell phones are everywhere.
Yes, and phones that people, mothers and parents are giving phones and iPads and tabs to children that have no limitations and control. A person can look at it. And two, we also do biology on reproductive organs in Senior 1 and Senior 2. And somebody is getting interested.
And Senior 1, Senior 2, you're talking about 12-year-old, 13-year-old.
Yes. So are we saying we are going to close out all those things?
Syllabuses.
No. So if you inform somebody that this is the best thing, this is ABCD, this is what it's going to do, and then you're not necessarily trying to tell them that go for sex. No, we are only trying to tell them, just in case this is happening, this is the best way to go. Morals have decayed. We have to be able to, even when religion is spreading high, morals are decaying.
Even parenthood has been neglected at a certain point. Parents are no longer doing
Mr. James, you left your house at 5, most likely, to be here at 6 to start the show. And most likely you're going to go back home at 7. Who is taking care of your children? Who is feeding them with information between the time you
Because they have to be feeding. Yeah.
And we hardly have time for our children to meet them. Well, this is not a family talk, but I believe it's also part of what people need to buy into and understand that once all these other things are failing, what can we do as a matter of urgency?
So you health practitioners think that if this information is disseminated, is put out there, it will really help save a lot.
Exactly.
Wow. Producer, mpaka ku namba z'essimu ezo bw'olina ekibuuzo kyonna ky'obuuza ku family planning ku nkola zino contraceptives, nkola z'ekizaala ggumba, erinnya lyo gy'okubidde n'ekibuuzo kyo, dokita waali agenda kwanukula ku kintu kyonna ekyetoololera ku bintu by'okuzaala embuto naye family planning majorly kubanga kyetubadde twogerako kuba essimu twogere ebyo. Doctor, what could be the myths and misconceptions concerning family planning methods?
One of the myths that we've gathered across time is that it causes dryness on sexual organs of women. And two, most people have told us they think that the family planning methods muluganda bagamba zisiriza amaji. Okay, which thing is not necessarily so. Others have said that they cause fibroids.
Okay.
It's not. I've seen people that have never used any family planning and they have very huge fibroids, multiple fibroids of all manner, intramural, serosal, and all these. So all of them. So those are myths that people have, and then they come with a lot of fear. Yes, some could be not myths, side effects that we know about, some of which I've already talked about, like the blood flow excessive, and a bit of increase in size of the body mass, okay? So, but all these are manageable.
Okay.
And people should not die there. They should come and then we try to...
Now, those are the myths and misconceptions. Yes. What could be some of the side effects?
Some of them I've already mentioned.
Okay.
The bleeding, bleeding that is...
continuous severe bleeding sometimes.
And then, we have some that have increased in size. That's something that we really can...
Back aches, are they some of them?
Pardon me?
Back aches.
At times, yes, we expect some. And then others have nausea once they take the oral contraceptive. A bit of nausea, a bit of abdominal upset. But those are common things that we can always manage. And then a person gets well.
Hello.
Yeah.
Hello, Nyabo. Twasuze bulungi Nyabo. Nyabo amanya go era okubidde wa?
Amanya? Agnes.
Wanje?
Naku Agnes.
Naku Agnes obadde obuuza ki maama?
Wanje?
obadde obuuza ki?
Nadde mbuuza tinsobola okufuna family planning nga ya myezi 3.
Okay. Ongambye okubiddewa?
Okuva Wakiso.
Okay, kale dokita kakuddemu. Hello caller. Tukubire ku ssimu amannya go ne gy'okubidde n'ekibuuzo kyo. Hello. Yes, doctor, you can go right ahead.
Injectable omukyala abuuziza waliwo obuyiso bwe tukuba obwa dipo bwa myezi 3. Waliwo n'obw'omwezi mwezi obuyiso nga bwa mwezi mwezi, waliwo n'obulala bwe tukuba nga bwa myezi 3.
Hello caller.
Hello.
Kendeza ku TV. Soko kendeza eddoboozi lya TV. Kendeza eddoboozi lya TV tukuwulira.
Jebaleko sebo.
Kale munange jebaleko. Erinnya lyo okubiddewa?
Nze Namugenyi nkubidde kuva Bukoto.
Yes, Namugenyi.
Musawo bankuba family planning okuva mwezi gwa 11.
Oh, sorry. Namugenyi.
Ayinza okuba teyafuna periods kati Namugenyi alayika kyabuuza nti okuva ku olwo teyafuna periods oba okuva ku olwo yafuna periods zaakumukumu ayinza okuba atandise n'okuseka ng'alaba ekibuuzo tumusoose. But all still those are hormonal imbalances okay, that come in when you take a family planning, especially when people are not willing to screen okay, to know whether you will manage this. So once that happens, go back oddeyo eri musawo yakuwa mugambe nti nina kino nekino waba tasobola kisobola akureferring ku musawo omulala asobola okimanaginga, and that will do a correction ebeerawo in less than 2 weeks. Notandika okunormalizing ngawe wali luli. So there is no worry for that.
So basobola okukyusa method awo wenyini.
Waliwo kye tukola awo kusinziira ku method kye wakozesa ekuleetedde
kitegeeza alina kujja Namugenyi oba omuntu enaatuuliza olina kuddayo eri mu basawo nobabuuza nti nafunyemu obuzibu bwe buti tukoze tutya. Okay. Hello caller. Tukubire essimu erinnya lyo gy'okubidde n'ekibuuzo ky'obuuza ku nkola yonna eya kizaala ggumba oba family planning. Waliwo ekyakutuukako olinamu obuzibu oyagala kutandika tunatandika and everything. Doctor,
abaami tulina method 2. Esooka ya vasectomy. Oba ng'omaliriza ng'owulira size mwami kintu gy'oyagala eya family yo ogimaze nga bakusala obuseke.
Okay.
That is the one that is approved in Uganda. Wayinza okubaayo ebirala ebiri external nga tusobola obikozesa
webafa bali bonna nga njala kuteekayo balala
nga tukozesa IVF, which is another expensive venture. Endala ya condoms for male condoms. Kati
fogambye tulina 2
ezo zetulina for now. Vasectomy
bakusala obuseke
ate omukyala eri tukola
obuseke obutambuza omusaayi
buno obutambuza enkwaso z'omusajja okubeera mu kisawo kyazo. Ekyokubiri ye condom ey'abaami
ate abaami tebajagala
bazikozesa because if they are not using them, condom consumption mu Uganda eri high, especially now that we are going to festive season. Almost all districts are in need of condoms. They are using them. Okubanduza abantu era bagikozesaako the first time they are with the twesanze the first 1 week 3 they think that now that is confidence enough for you to not use a condom after.
Okay, Doctor, bameka batera okwettanira enkola eya vasectomy ku percentage gwe bbanga lyomaze mu gundi gye bali abaami
gye bali. It was one of the programming of Minister of Health. Waliwo yali ekiseeringa ku bantu be bawulira nti basobola okukituukiriza, especially bw'oba ofunye family size gy'owulira nti yeeyo ne age with time abantu bakowa okuzaala n'agamba kankiveeko nsala obuseke ate ekirungi nti tebukendeeza maanyi bw'obusala tebukendeeza maanyi ga kisajja just nkwaso nti zisigalayo eno and then the tube is empty. So that is all. But I've also seen men that are in their 50s 60s that they think now they should not have any more children and then they have ceased to do that. I've also seen children, men of 35 years. I don't know why they think they should do that. And they have come to us. You counsel them and we're like, are you sure of the decision? And they are like, yes. I've also seen women of 30 years. And then why? Because some people think they will not attain the socioeconomic levels they desire.
Family planning, you know, yagenderera nnyo bakyala okusinga abaami.
Abakyala bebasinga okwetika embuto.
Okay.
Era
bebasinga n'ebizibu. Waawo mu nkolezo bebasinga n'okubonaabona kubanga omwami amufunisa olubuto ndiye n'agenda
n'adduka. So abamu bakola decisions waste because of circumstances like that, and they come to you, they want to have a TL. No counseling anaga musawo nze kyenjagala nti sayininga wano nti nsayininze, and then you do that.
Kakati mu kusayininga wano asayininga nga ye oba naye abeera ne next of kin?
It would depend. Naye kuba abeera sober. They're sober-minded. Usually, we want a next of kin to help them, but usually they come alone. And then they do the signatures.
Nti watyanga asalawo ali mu kusalawo mu busungu oba nga tulowooza mulamu ng'ate si mulamu.
Oluusi tubagamba sokoddeyo kokomewo. Tulabanga decision eri mu depression, stress and what. That's a mental health issue.
Doctor,
so we need to.
Kamera yeno.
Yes, sir.
Kigambo ky'ondyagadde okusembyayo ku nsonga eno.
Abantu bagendewo abakugu babategeeze ebirungi n'ebuzibuzibu obusobola okuva mu methods ze baagala, okole decision entuufu okusinziira ku musawo kyakunnyonnyodde, obeere nga weeyagaliramu ekyo kye walonzeewo, obeere ne family size gy'osobola era gy'osobola okuwanirira mu economies zino eziri wano mu Uganda n'ebweru waazo, oluusi ezitatusobola kubanga twagala ku living standard gye twandyagadde okwetuusaako ng'oluusi tekisoboka. Byebimu ku ebyo byensobola okugamba abatuwuliza n'abatulabye olwaleero. Yes, sir.
Njagala okwebaza okutulaba. Tujja kudda ne Dokita agenda kudda ku Monday eri. Lujja kuba Christmas.
Christmas, okay. Christmas.
Anti munange tetuwummulaffe abannamawulire abasawo tulina okusigala nga tukolera eggwanga. Kati awo tujja kudda era Dokita ayongere tulambule tugenda kwogera kuba tugenda kuba twetooloolera nnyo ku nsonga zino. Oba olina ekibuuzo kyonna nga tosobodde kufuna mukisa gwe kiwandiike ku mutimbagano gwaffe Facebook, bw'ogenda ku X ku mutimbagano gwaffe ffe tujja kuba tubifuna era Dokita bw'anadda tujja kutandikira awo. Erinnya lyange Kintu Mutesaasira Senior. Tujja kulabagana olunaku lw'enkya. Katonda mungi abakuume, mwekuume ate mwagalane. Mwera.